Let's break down Botox. Whether you're a first-time patient or you're experienced Botox neuromodulator user, this is going to be helpful so you are a more educated and informed patient, and so that you can find a good injector or you can ask your injector about certain areas that you may not be getting treated that could be beneficial. I'm Jordan Harper, board-certified nurse practitioner, founder and CEO of a skincare line called Barefaced, focused around the concept less but better. Also how I treat all of my aesthetic procedures as well. I have over a decade of experience in the medical field as an injector, and I believe in a less but better philosophy across the board, basically everything in life, and especially when it comes to injectables, because you want to have a natural result. And so I'm going to give you some tips and tricks on how to achieve a good result, how to find a good injector, basically like everything you ever wanted and maybe didn't want to know about Botox. So let's get into it. If you're new here, I typically discuss everything skincare related, aesthetics related, coming from a standpoint of less but better. Let's keep it simple. Let's keep it reasonable, achievable. I'm a busy mom of 4. I want to do things that are going to simplify my life, and I want to age gracefully. So if that sounds like something you're interested in, make sure you don't forget to subscribe. Let's get into Botox. When I say Botox, I'm talking about all neuromodulators. Xeomin, Dysport, Daxxify, Jeuveau, but let's just call it Botox. It's just a catch-all. It's well understood. Neuromodulator is just too long of a word, but that's what I mean. So when I'm referring to Botox, I'm referring to every neuromodulator. I'm gonna cover everything from how Botox works, when you might wanna consider a treatment, what you can expect from the results, potential risks, potential side effects, and so on. So let's break it down. Let's do a little backstory on what Botox is, when it came from, how long it's been around. Botox has been around for decades. It was first approved for cosmetic use by the FDA in 2002. Prior to that, it was used for migraines, muscle spasms, similar to how Latisse was discovered when treating glaucoma. The same thing with Botox. It was used medically and then approved cosmetically years later. It is probably not the exact statistic, but I'm sure it is the most widely used aesthetic treatment out there. If it's not something that you feel comfortable with, don't get it. I never am gonna push any kind of procedure, any kind of product on anyone. So this is really for people who are interested in Botox. I feel comfortable with its safety. I've been getting it for years. Millions of people get treated with Botox every year. But again, you do what you feel comfortable with. Botox is a purified protein that temporarily relaxes the muscles by blocking the nerve signals. In aesthetics, we use it to relax dynamic lines of expressions. These lines over time, this constant crunching, whether we're smiling, lifting our brows, they cause wrinkles over time. By relaxing the muscles of expression, you're going to soften the appearance of the face and you're going to minimize fine lines and wrinkles. Botox is measured in units, in different areas of the face, and different areas being treated need different units. And typically, if it's an on-label usage, meaning the FDA has approved that usage, there is a recommended dosing rate. And you typically want to follow that because that's been studied to have the efficacy over the 3-month period. A lot of times when people are unsatisfied with Botox, one of the culprits can be underdosing the area. And what can happen is they start to get movement back sooner than expected. So dosing is really important, and properly dosing certain areas are really important, so that way you don't undertreat or overtreat an area. Like if you treated the same amount of units that you did on a forehead or the glabellar complex on the upper lip, you would be like this. You wouldn't even be able to talk. So you need a couple units here where you need 20 to 25 units between the brows. So it all depends on the muscle strength and the area being treated. I know a lot of times patients get kind of concerned when you hear like a higher dosing, but don't be afraid of that. It doesn't mean you're going to have a less natural result. You can still look really natural as long as the technique's good, the injector is using the appropriate dosing per area. You can still have a really natural result. So don't be afraid of the units. That's something that patients are always really afraid of if they hear like a high amount of units. When to consider Botox? There is not a one-size-fits-all answer for this question. Something that people call baby Botox, and people think, oh, I'm going to start that in my early 20s. Here's the thing. When should you get Botox? The general rule of thumb is when you start seeing these lines at rest. So a line of expression at rest, this is one that typically people see. If you're not doing this face and you're still seeing this line present, or if you're not lifting your brows and you're still seeing these lines present at rest, that's a good time to consider Botox. Sometimes when you're like 20, you start to see these lines, and that actually means that your skin is dehydrated. And so that's more of a skincare solution. But if you're over the age of 30 and you're noticing these fine lines at rest, that's typically from years of expression, and Botox can be a great way to prevent and soften those lines. There's no technical time to start getting Botox. However, if you are a person who does want to minimize the appearance of fine lines as you age, I do recommend starting to get Botox sooner than waiting until those lines have really etched in. Now, it's never too late to get a treatment, okay? There's always hope, but it is a lot harder to correct than it is to prevent. So if you start to see these lines, or maybe you like have a parent who you notice, like for example, I know my parents have a really strong line right here. As soon as I started seeing that line stick around, maybe that was in my late 20s, I started being a little bit more intentional about treating that with Botox. So there's definitely a preventative aspect of Botox, and catching it early rather than waiting till those lines are deeply etched in. It's a little bit harder to correct those once they're really set there for a while. Baby Botox is like a marketing term. I like baby Botox, and to me that just means like treating Botox is more preventative, and maybe you're just targeting certain areas of the face that you're noticing fine lines stick around, but like you still want to be considerate of dosing because you don't just want to like lightly treat areas and not fully correct them. So baby Botox to me is just a marketing term, but the thought behind it, the way I like to think of it, as preventative. The way I think about baby Botox is like more from a prevention standpoint. So if you are noticing some fine lines stick around, that's a good time to maybe consider, hey, is this something I want to do? But it doesn't always mean like lesser of a dosage. Will Botox cause muscle atrophy over time? I love this question because this is where following the guideline of waiting at least 3 months in between your Botox treatments is really important. Sure, will the muscle weaken over time? Absolutely. Now, if you're not following these recommended treatment windows, which are at least 3 months, and you think, why would I get Botox before 3 months? Wait till you start getting it regularly and you start seeing the movement come back. I have had so many patients come back before the 3-month period and want to be retreated because they're seeing these fine lines come back. If you wait these appropriate lengths of time, so at least 3 months before getting an additional treatment, you are going to prevent the muscle from atrophying away. Now, but if you get into a habit where, and really your injector should control this, like they shouldn't allow you to come back and get Botox every 6 to 8 weeks, even if it's just a little touch up. You need to get your treatment, and once you get your dosing right, maybe that takes a couple times. Once you get your dosing right, you and your injector are kind of like vibing and you're like, okay, she gets my face now, we've got this thing going. Once you have that, then you maybe are going every 3 to 6 months, somewhere in that window, but you don't want to get into a routine where you're going more frequently than that. The only time I ever make an exception for my patients when I do this is if it's their wedding. Otherwise, I'm like, no, it has not been 3 months. We are not going to treat you. As far as areas on the face where you get treated, you can treat the full face. And I'm going to show a video where I would mark a full face, and I actually like a full face for a more natural result. And again, it sounds counterintuitive, but treating the full face yields a more natural result if done properly. The most common areas that you see treated are the upper third of the face. Now, when you come down to the lower third of the face, and again, you can look at this video here, when you come down to the lower third of the face, the units amounts drop dramatically, except for in the masseter, which is a really, really strong muscle, but it's a really nice way to get a more natural, softened look of the entire face. So this is where there is a variation between different neuromodulators. Botox starts to kick in around 3 to 5 days, full results seen at 2 weeks, whereas Dysport starts to kick in a lot sooner, and you'll see your results a little quicker than Botox, and then your expected longevity for pretty much every neuromodulator on the market is around 3 months. It doesn't mean you're going to be frozen for 3 months. It means that's your window of like seeing results. So your peak results are probably going to be at 6 to 8 weeks, where you see like the least amount of movement, and then after that 8 weeks it kind of tapers down. So it's like you slowly see it activate, and then it peaks at 6 to 8 weeks, and then it tapers down. If you're not getting longevity out of your Botox treatment, there could be 2 main reasons. 1, you're not getting the proper dosing. So this is why proper dosing is important. 2, you might be zinc deficient. There's been a study done in 2012 that shows that pre-treating with zinc 50 milligrams and post-treating for a couple days after will help with your Botox duration.